variant eventually tested positive several days after testing negative. A group of medical frontliners slams the dismissal of the complaint against Senator Coco Pimentel, who allegedly violated quarantine protocols. The Alliance of Health Workers says this is clearly VIP treatment. Pregnant women are out of the government's vaccination program, following the recommendations of the World Health Organization. And Malacanang says the national government is worried about the possible spike in COVID-19 infections. The IATF is now studying the next possible quarantine classifications. Fast, focused, and fearless. Here's everything you need to know as you jumpstart your day. I'm Charles Lejano. Starting off today's newscast with a magnitude 7.1 earthquake rocking Mindanao last night. Volks recorded the epicenter of the quake in Jose Abad Santos in Davao Occidental. At least 16 aftershocks have been reported since the initial earthquake happened at past 8 p.m. on Thursday. But the agency assures the public that this is unlikely to create a tsunami. Up to intensity 5 was recorded following the initial tremor. These were felt in General Santos City, as well as in Glan, Kiamba, Maitum, and Malungo in Sarangani. Intensity 4 was recorded in Mati City, Davao City, Cotabato City, and Digos City. Same goes for Santa Cruz and Davao del Sur, and Tagum City in Davao del Norte. Other parts of Sarangani, including Alabel, Maasim, and Malapatan, also felt the quake at intensity 4. Also in Coronadal City, Tupi, Lake Cebu, Banga, and Polomolok in South Cotabato. Meanwhile, intensity 3 was reported in San Francisco in southern Leyte, Datublati, Sinsuat in Maguindanao, Zamboanga City, Cagayan de Oro City, Tandag City in Surigao del Sur, and Santo Niño in South Cotabato. And intensity 2 was felt in these areas being flashed on your screens. Volks says Volks says last night's earthquake in Davao Occidental may be related to the Philippine Trench. In an interview with Radio 5, Volks director Renato Sildum said the depth of the quake was recorded at 11 kilometers below the ground. However, Sildum said that these recent tremors aren't expected to cause any structural damage.
Ito po sa General Santos City at sa Kiamba, Sarangani at ilan pang mga bahagi ng Kamindanaoan. Ito pong intensity 5 ay hindi naman nagiging damaging. Ito pong intensity 5, Glan, Maitom, Kiamba, Malungon, Sarangani kasama ang General Santos City. At yung iba pa ay intensity 4 tulad sa Davao City, Mati, Digos, at Santa Cruz, Davao del Sur. So ito pong mga naramdamang pagginig, hindi naman mapaminsala.
For his part, General Santos City local and DRRM officer Bong Dacera said they immediately dispatched teams to assess the situation in the area. While no damage to any structures were reported, they still implemented safety procedures.
Ng classes, ng office, work, this morning, para po pagbigyan daan po yung ating mga inspectorate teams na mag-conduct po ng inspection sa mga structures. Intensity 4 pataas, that's part of the standard operating procedure.
The Health Department recommends the conduct of repeat COVID-19 tests 5 days after the arrival of inbound passengers. This after some close contacts with the first UK variant case in the Philippines tested positive for the virus after initially testing negative. Greg Gregorio gives us details.
Another close contact of the country's first case of the British variant tested positive for COVID-19. This despite initially testing negative upon arrival from Dubai on January 7. The co-passenger is now the 14th person to get infected. What worries authorities is that 4 of them initially tested negative, including the index case's girlfriend. That's why the Health Department now wants all inbound travelers to undergo a second swab test 5 days after arrival.
So, sa ganitong paraan, maaari po nating makita, no? And appropriate po yung timing ng testing, and we can be more certain kung talagang negatibo o positibo itong pasyente na ating itinest.
The DOH says they have to finish a full 14-day quarantine even after testing negative for the second time. Of the 14 specimens from the close contacts, 6 have been sent to the Philippine Genome Center. This will determine if they also have the more infectious variant. The 8 others underwent another swab test. Their cycle threshold value had initially surpassed 30, meaning viral load is low and cannot undergo gene sequencing. The DOH considers the possibility that a low viral load may also mean less chances of carrying the British variant.
Characteristic of this UK variant is a very low city value. So, una, the fact na mabataas yung kanilang city value already begs yung question na, ay, UK variant pa ba talaga to?
The Octa research team, for its part, thinks there are undetected British variant cases in the country. It cites 21 travelers from the UK last October to January, all of whom tested positive, as well as Tagagayanon, who became positive for the British variant upon arrival in Hong Kong.
We made the calculation, and the probability that at least one of them has the new variant is 99.96%.
But the DOH maintains there is still no local transmission of the British variant.
At kung nandito umiikot na yung UK variant, we should be seeing some surges, no, from the municipality where she's coming from.
Octa research also predicts that Metro Manila cases may balloon to as high as 540,000 by the end of January if the present R0 value of 1.09 won't decrease. But according to the DOH, cases in the National Capital Region plateaued to around 5,000. For now, the DOH says it's closely monitoring an uptick of cases in provinces after the holidays. Moderate risk areas include CAR, Regions 1, 2, 3, 7, 10, and 11. For News 5, Greg Gregorio, we are One News.
Still on the new UK variant, a medical expert is calling on the government to review its local travel protocols. Infectious disease specialist Dr. Jean Solantev said authorities need to prevent the new COVID strain from reaching the provinces. He also notes that secondary close contacts with the patient with the new variant need to be retested, even if they don't have any symptoms. Solante added that current testing protocols also need to be modified because of this new variant.
I think the most important part here now is also looking at the secondary and the tertiary contacts of these 14. And from there, they need to really adopt and change some of these protocols, especially on timing of testing.
I'm Jason Gale. I'm a health editor with Bloomberg News in Melbourne, Australia. And I'm going to talk about the new coronavirus variants that are circulating in various parts of the world and worrying a lot of scientists. So what are the new variants and what do we know about them? There are 3 variants of the SARS-CoV-2 virus that scientists are especially worried about, and these have taken hold on 3 different continents: Europe, Africa, and South America. Scientists have given them different code names that distinguish them from the other circulating forms of the pandemic virus. In Europe, a strain dubbed the B117 lineage emerged in southeast England in September. That strain contributed to a spike in cases in December that sent the UK back into lockdown. Health officials have warned the strain could become dominant in the US as soon as March. In southern Africa, hospitals are facing pressure from a resurgence driven by the 501YV2 variant that was first detected in Nelson Mandela Bay in South Africa in early October. Since then, it's led to a steep rise in cases across 9 southern African countries, as well as the Seychelles and Mauritius. In mid-January, a case was reported in Denmark. And in Brazil, researchers are warning that a so-called P1 variant spotted in Amazonas in December could be aggravating an outbreak there. Are they more transmissible or more deadly? Well, the current evidence is that these new variants are indeed more transmissible. That is, they are more easily transmitted from one person to another than the other SARS-CoV-2 variants in circulation. But scientists so far don't believe these variants are more likely to cause severe illness or are more deadly. But since these variants are more contagious, more people are getting COVID, and as a result, more people are needing to be hospitalized, and a small subset of those are dying. So these variants are more serious. What causes new variants or mutations? Well, viruses mutate all of the time as they infect cells and replicate the genetic material, often making mistakes in the process. Sometimes these changes weaken the virus, and sometimes the mutations can make the virus better, giving it some advantage over other variants. When these mutations give the new variant an advantage, they can proliferate and become the dominant strain infecting people. And that's what we've seen with these 3 variants from Europe, Africa, and South America. Scientists pay most attention to mutations in the gene that encodes the SARS-CoV-2 virus's spike protein, which plays a key role in viral entry into cells. Vaccines are also designed such that when we are immunized, we generate antibodies that recognize features of the spike protein and then grab hold of the virus and stop it from infecting cells in our body. So mutations in the gene that encodes for the spike protein are worrisome. Will vaccines still work? Well, so far it seems that the currently available vaccines will still be effective. And that's because the antibodies generated in response to the vaccine detect a number of features of the spike protein, so they can still recognize these variants. We also have T cells, a type of white blood cell that can detect and kill the coronavirus once inside our cells. Over time, as more mutations occur, vaccines may need to be altered. And this happens annually with the seasonal flu, which evolves quickly. Unlike flu, coronaviruses have a genetic self-correcting mechanism that minimizes the mistakes they make. Even still, vaccine makers say that COVID-19 shots that have proved effective in trials can be easily tweaked if necessary. I'm Jason Gale in Melbourne for Bloomberg News.
Health workers believe Senator Coco Pimentel is receiving VIP treatment following the dismissal of the quarantine violation complaint filed against him. Recall that Pimentel was criticized last year after he accompanied his then pregnant wife to the Makati Medical Center, even though he was supposed to be under quarantine. Pimentel received news that he was positive for the coronavirus while he was at the hospital. Alliance of Health Workers President Robert Mendoza said it's clear that authorities are favoring Pimentel, noting that average citizens who violate the quarantine face tough sanctions.
Nakikita natin na merong talagang VIP treatment doon sa mga malalapit na mga tao kay Pangulong Duterte.
Complainant and lawyer Rico Quicho slammed the Justice Department for letting Pimentel get away with his violation scot-free. He said the DOJ is blind, mute, and deaf towards such injustices. Here are the biggest stories from the dailies. The Health Department says pregnant women are automatically excluded from the government's vaccination program. This comes after the World Health Organization advised authorities to exempt them from using Pfizer's vaccine. But the agency told Pangmasa that they will still consult obstetrics and gynecology experts to find out which vaccines are good for pregnant women. The Philippine Star reports that the IATF has yet to issue a new quarantine classification for the country, despite the increase in COVID-19 cases. Pala spokesperson Harry Roque said data analytics will dictate the quarantine classification for NCR and the rest of the country over the next few weeks. And this from the Freeman, but barangay control points are set to return in Cebu City. This comes after it recorded 689 active cases, which is the highest since August. Control points will be manned by a police officer and a village watcher who are tasked to arrest health protocol violators. Here are the stories to watch out for later today. The Senate Committee of the Whole resumes discussions on the government's vaccination program. U.S. President Joe Biden announces a fresh set of strategies to address the COVID-19 pandemic. And LRT2 Santolan, Katipunan, and Anona stations finally reopened today after more than 1 year of closure. And that's how the day is shaping up to be. Join us later at 10 a.m. as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.